Huge changes came this past February with prescribing Sublocade and Brixadi. If you're a patient receiving these long-acting injectables or a prescriber prescribing them, major changes you need to know about: initiation, location, timing, and storage. We're going to talk about the half-life of these medicines, which one might be better for you depending on your starting dose, and some really interesting new topics. Sublocade came into the US market around 2018. This is a long-acting injection, a once-a-month injection of buprenorphine. A few years later, around 2023, I think, Brixadi came. They're the new kid on the block. There were some issues with Brixadi that made Sublocade want to change their game and compete with it. Brixadi is also a once-a-month injectable, and they also have a once-a-week formulation. We're not really going to talk about the once-a-week formulation because I don't think there's really a big use for it. Personally, they are using it for early inductions, but we can talk about that later. So when Brixadi came into the market, there were some real appealing features that made it more desirable as a provider and as a patient. And so Sublocade this past year in February changed a lot of their prescribing recommendations and indications to make it more competitive. And we're going to go through those because it really changes the landscape on these medicines, which have been a game changer in the world of opiate use disorder treatment. First thing we're going to talk about is alternate injection sites. So I'm going to show you here the approved injection sites for Brixadi. So Brixadi is a smaller needle. It's a 23 gauge needle. It's less volume. And it is approved for multiple injection sites, including the back of the arms, the buttocks, the glutes, the thighs, the abdominal wall. And this is really appealing because Sublocade, which was a larger volume and a larger, more painful needle, was only indicated into the abdominal wall. I'll show you this picture was the initial approval areas for Sublocade, which is just the abdominal wall. And this is the new areas of approval for Sublocade. So you can give Sublocade now in all the same areas as you can give Brixadi. Keep in mind that Brixadi is a much smaller volume. The 300 milligram Sublocade is 1.5 mils. In my opinion, that's way too much for the arm. That's going to hurt so bad. I would not be doing the larger volume, the 300 milligram in those sites, except for the abdominal wall and the butt. But the smaller 100, which is just half a mil, I think you could do in the arm. The other thing that's important is that when you inject the Sublocade, it's forming a ball, like a marble or like a golf ball, right? But because it congeals into this sort of time-release product, when you use the Brixadi, it's also congealing subcutaneously, but it's more like a lake. So imagine like a frozen lake versus a golf ball. So aesthetically and I think pain-wise, the Brixadi has an advantage. Also, it's a smaller needle. I mean, it's a 23 gauge versus a 19. So when you do that 19 in the abdominal wall, or now the thigh or somewhere else, that's a big injection and it hurts. And it's not really going through the skin that hurts because we can kind of numb that up or use some ice, but it's when you get underneath the skin and it starts to expand, you can't numb that up and that hurts. So I think Brixadi is less painful. It's a smaller amount. It's a smaller needle. Sublocade definitely hurts more. It's a bigger needle. It's a bigger amount. Okay, number next is initiation of Sublocade or Brixadi. And I think this is going to take a while to change because of insurance companies' things. So Sublocade required at least a week of transmucosal product before you could do a Sublocade shot. Now in practice, I don't think we were all doing that, but you had to have some experience with a transmucosal buprenorphine product. Brixadi said all you had to have was one dose and you could do Brixadi. So you could do like 4 milligrams, you could do the shot, which means you could just do it in the same day. You could take somebody who's not on buprenorphine at all and give them like 4 milligrams and then give them the shot. Or you could take someone who's already on buprenorphine and then give them the shot. Well, the advantage is that some of these studies have showed that you can give Brixadi like in the ER or for induction, or somebody in acute withdrawal. You can take somebody in acute withdrawal and just give them Brixadi. And they didn't have 7 days behind them. So I think Sublocade saw that as a prescribing disadvantage. So of course the new Sublocade prescribing guidelines is they just to have one dose, 4 milligrams, and you can give them a 300 milligram shot. So they don't have to have 7 days anymore. So the previous indication was 7 days of transmucosal product before you could get the shot. Now it's just 1 dose, and then you can get the shot just like Brixadi. What's weird about that is the insurance. I get calls from a lot of patients because a lot of insurance companies want people to be on 8 milligrams or more before the insurance company will approve the Sublocade. And we're using Sublocade for very low doses, 0.5 milligram, 1 milligram. So patients call me like, well, do I have to go up on my dose? I don't think you do. But with the new indications, we'll see what the lag is, because you don't need to be on 8 milligrams you don't need to be on any Sublocade at all now to get it approved. So hopefully that trickles down into patients having more access to the medication. The new prescribing indication is that the second injection of Sublocade can be administered as early as 1 week after the first injection. So we were having patients, and I think I said it in a previous video, get the first dose of Sublocade. And you've heard me say sometimes the first dose doesn't really work that well. You're not at steady state, it hasn't stacked, it hasn't built up. So now they're saying you can give the second dose of Sublocade a week after the first. This is interesting. So when I order Sublocade, I'm just going to order 2 doses. They can send them both, and then we'll do one a week later. I don't think insurance is going to pay for 2 in 1 month, but we'll see how that goes. So I think that's one of the areas where Sublocade saw a need, was to increase or shorten the duration between the second dose. Next is storage. Brixadi did not require refrigeration. This is huge, as we've tried to lower the barrier to get people onto long-acting injectables. You have mobile medicine, you have street medicine. You can't keep these things refrigerated in a lot of environments. And we have one refrigerator just full of Sublocade. So Brixadi does not require refrigeration, which is great. Sublocade had the indication that it could be unrefrigerated for 7 days, and then you had to throw it out. So it had to be refrigerated. The new prescribing information for Sublocade is that it can stay out for 12 weeks, and then you have to get rid of it. So we're still storing them in the fridge because the expiration dates are much longer than 12 weeks. So we'll have patients not do it for a few months and then come back 4, 5, 6 months later, and we can use their shot because we keep it refrigerated. So I don't know if that affects our practice, but in a lot of environments, street medicine, mobile medicine, not having it refrigerated is clutch. I think it's going to access more people. Lastly, we need to talk about, well, which product is better for you? One of the advantages of the Sublocade and Brixadi is the long half-life. Sublocade has a 43 to 60 day half-life. Brixadi has a 19 to 25 day half-life. Brixadi has a significantly shorter half-life. And I think this is important because when we give multiple doses of a long-acting injectable and we stop and we let patients taper off, we want like a really long glide scope on that, right? So we want the longest acting product there is. And also, when you give the doses sequentially, say every 21 days or 28 days, they stack and they get more steady state. So let's take a look at what happens if we use the 300 milligram Sublocade every single month versus the 128 Brixadi every single month. That's the highest Brixadi. Let's compare the highest Sublocade every single month to the highest Brixadi every single month, okay? And what those levels are. And I'll show you to them here. You can see here that 6.32, that's nanograms per milliliter, is the average serum concentration in the blood in these 32 volunteers when they got 300 milligrams a month, steady state. That's basically 4 or 5 months of 300. Now, keep in mind, this is 6.32 nanograms. 2 nanograms per mil is the relatively arbitrary number that the industry has established that you need to be above to not have cravings or withdrawal. Now, I don't know if that's the case in most people, but that's what they use. So if someone gets 300 milligrams of Sublocade a month, their blood level is 6.32 nanograms per milliliter on average. Okay, remember that number, 6.32. For comparison, if they're on the 100 every month, they're 2.87. So they're still above that level of not having withdrawal and craving. Now let's look over here at Brixadi. The highest dose of Brixadi, the 128, their steady state level was 3.9. So it's like half. So again, I think that plays into the fact that it has a shorter half-life, so it's not stacking, it's not staying around longer. Now, obviously, this has to do with a different formulation and drug release properties, but the average serum concentration on Sublocade is significantly higher than the average drug concentration on Brixadi, given at similar intervals. And I think this is important because when you stop these medicines to taper off, you want the longest half-life possible. And again, 43 to 60 days versus 19 to 25 days. I think Sublocade's the winner there. When we're using these doses to taper off, that might be a better plan for people. Now, where I think Brixadi may have a leg up is if we want to transition to a longer acting injectable on someone with a super low dose of medicine, like we have a lot of patients come in on a 0.5 milligram or a milligram, they can't get off of it, they might do better doing just doing the lowest doses of the Brixadi monthly, because their serum concentrations are going to be lower on average, and I think they're less likely to be over-medicated. Because we've just been giving these patients like 100 milligrams of Sublocade, and they oftentimes feel over-medicated for those first few days or half a week, and then they're fine. And I think Brixadi, is a little smoother. I don't think the levels are quite as high, and that might be a better product for them. So again, with that longer half-life, I think you're going to get a longer glide scope. So keep that in mind. Okay, so those are the highlights of Brixadi and Sublocade, the new prescribing guidelines. Hopefully that's helpful for you as a prescriber or a patient. Let us know if you have any questions. Thank you.